Hi everyone. We're going to talk about Chapter 9. This is week 2 in community health. Hold on. Sorry. Here you go. Play from start. All right. So Chapter 9 is population-based public health nursing practice. And this goes over the intervention wheel. And I'm going to show you their website that talks about the intervention wheel in depth as well. So the objectives of this lecture is to identify components of the intervention wheel, describe the assumptions underlying the intervention wheel, and define the wedges and interventions of the intervention wheel. To differentiate among the 3 levels of practice in public health, so community, system, and individual family, and then apply the nursing process to all 3 levels. So the intervention wheel origins and evolution. So grounded theory process by Minnesota public health nurses. And let me show you kind of where that came from. All right, so public health nurses worked collaboratively with other professionals in the communities within Minnesota to create environments that promote health and prevent disease and disability. They used an ecologic approach, which is a type of study to respond to the needs of the communities and to become proactive in program and policy development. All right. So public health nurses work in schools, homes, clinics, jails, shelters, out of mobile vans, dog sleds, it says. They work with communities, individuals, and families to make systems that impact the health of the communities, okay? So I'm going to show you what the wheel looks like. Let me just back up here. So you can see the whole wheel. All right, so as you can see, there are these 6 layers here. So you have systems focused, community focused, individual focused. Then you have population based, all around, okay? And here are all the interventions that you can do. The only 2 that won't hit individual focus is going to obviously be community organizing and coalition building, but individual. But in the end, what is good for the community and system will eventually trickle down to the individual. So we've talked about individual focus. I mean, most of nursing is based on that kind of individual focus. But when it comes to public health, it's individual focus, obviously at the prevention and promotion level. And then a lot of times we have to look at the community in itself, right? The community where people are, and then the system, the healthcare system in general. So just to go over a few of these interventions. So there's collaboration, and this is a big one, right? It's not just about collaborating nurses and doctors. It's about all allied interdisciplinary health, along with communities. So when you look at health promotion, disease prevention, you're not just collaborating with other health groups, you're collaborating with any community group. So schools, churches, rec centers, you know, most YMCA chapters have a diabetes prevention program, and that is due to community collaboration. Community organizing, coalition. The Red Cross is a really great example of that, teaching, you know, baby classes and baby CPR, because for those who work in pediatrics, we all know that those first, 60 seconds of a respiratory distress in a child is really important, and it's important that parents understand how to address that. Health teaching happens at all layers, delegated functions. So who are we delegating things to? And every community is different and every system is different. So do you have community nurses that go out to each neighborhood and discuss safe sex, or do you have community health workers? And either way, they're both effective, right? What if you are in a community where there's a lot of distrust of outsiders? Well, then you're going to want to delegate really important education topics to people who others can trust. So I want to get back, we're going to get back to this wheel. But I do want to talk a little bit about, go through stuff from this lecture. All right, so they identified the core public nurse function levels. So individuals, we talked about that, community and systems, okay? So you can see that individual or family level, we are going to obviously discuss, oops, I'm sorry. If we're talking about a baby, we're also going to discuss maybe grandparents and moms, the population aggregate level. So that's the group in general, and then the community level. All right, the intervention wheel origin. So they did a systematic critique to validate interventions through best evidence. Anytime you're going to look for an intervention to apply to your practice or to some sort of problem, you should always do a systematic critique of what's out there, okay? So if you're ever asked to do a project, like pick out a problem within your practice and come up with a solution, this is what they're talking about, okay? So Minnesota's public health system went through and critiqued different interventions at the individual, community, and systems level to identify the best practice for each intervention. So we talked about those interventions, right? Like delegation, collaboration, community programming. So they did a comprehensive search of public health nursing literature. They also surveyed 51 BSN programs in 5 states to identify the most frequently used community health and public health nursing textbook and reading. This Stanhope book that we use, and there's also a few different versions within the community health setting, is probably the most popular community health and public health book. It's really great. And then also the different readings. So some of the readings I've posted on there come from kind of this whole thing that gets that was in this study. So they identified 665 articles, books, papers, dissertations, conference proceedings, and they critiqued for rigor. So again, one of those things when someone talks about doing a review of literature, you're critiquing each article, each book to discuss the findings, the weaknesses, the strengths, and then the level of evidence, which is that triangle level of evidence I will show you at the end of this lecture. So 221 sources met the criteria for further consideration. So it got honed down from 665 to 221. And here it's broken down into all the interventions. So there's 16 advocacy, 13 case management, 12 coalition building, 21 collaboration, and down, okay? And each source was independently rated for application to practice by at least 2 members of this panel, okay? So the 42-member panel deliberated the evidence during a 2-day meeting to develop a consensus on which interventions, definitions, basic steps, and best practices would be used for each intervention. So again, picking the strongest evidence and also what evidence best worked for the intervention in their setting. Then they did 2 rounds of a modified Delphi process to achieve clarification and agreement on the revised intervention set. So Delphi process is a form of communication to make sure you're reaching a consensus. And I will talk about that more in informatics. So if you take my informatics class, you'll see what I'm talking about. Field tested with 150 practicing public health nurses through regional training. Then it was critiqued by a 20-member national panel of expert public health nurse practitioners and educators. And then public health interventions made applications for public health nursing practice. So this intervention wheel that was designed in Minnesota is actually applicable to all public health services in the nation. So it's a really cool long-term ecological approach. Ecological studies is a form of epidemiology, meaning like the study of disease, but ecological studies are looking at risks of exposures within groups. And then you can also do kind of ecological approaches, or they're also called community intervention approaches, where you apply programs or interventions at the community level and compare it to similar communities as the control to see if the outcome is helpful. And again, it's done at the group level and not the individual level. And that's really important to understand because remember, the group level is general consensus, whereas individuals have their own risk factors and internal and external strengths and weaknesses.